Welcome back to Ozarks Tonight. Well, it's time once again to check in with a physical therapist from Cox Health. Shauna Townsend is joining us this month. We're going to be talking about an issue that affects a lot of people here in the Ozarks, and that's chronic pain. It's a thing a lot of people are dealing with. Now, explain what chronic pain is and who it affects mostly.
Yeah. So what I want to kind of explain a little bit about the difference between chronic and acute and recurrent pain, because that has a lot to do with what that is. It's usually in terms of time. So if you get hurt, you get injured, and that pain lasts 4 to 6 weeks, that's considered acute pain. 3 months or more is considered chronic pain. Okay. People that any kind of pain anywhere for more than 3 months of time is considered chronic pain. So
are these usually situations where people come to you where they might have been dealing with a pain in a certain part of their body for years on end even?
Absolutely. Absolutely. We see people that have had, a car accident 3 months ago and people that have had pain for decades. And sometimes they've been seen and sometimes they haven't. A lot of times they don't get to somebody that specializes in chronic pain, which makes it harder because they don't get everything that we do as a chronic pain clinic.
Sure, absolutely. And are a lot of these injuries that people have, is this pain a result of injuries a lot of time that people might experience, or are there other things that could lead to chronic pain as well?
It could be from an injury, a back injury, a car accident, things like that. But a lot of times the body just kind of starts falling apart for whatever reason.
Sure.
And that can cause chronic pain. Fibromyalgia is a good example, A lot of times there's no known reason why it starts, but anything can cause chronic pain.
Wear and tear over time can sometimes do it, right? Okay, well, let's get into your specialty then. Treating this chronic pain through physical therapy. I'm sure it depends on what exactly the pain is and where it's located, but what are some techniques that you use to address that issue and make it a little easier for people?
Well, there's 3 things that we like to hit real hard with chronic pain patients. The first thing is education. The most important part of understanding pain is explaining that to the patient. In fact, we put together a number of classes called Explain Pain classes that we have online, actually at Cox Health right now. These classes go through and explain the difference between the physiology of pain, how your brain interprets pain, and then different ways to diminish those symptoms. Lots of different techniques. The other thing we do is we do a lot of hands-on stuff. We do a lot of what we call manual therapy techniques. And with that, we can work the nerves, we can work the soft tissue, we can work the joints, we can stretch, we can mobilize, we can get things loosened up. If we don't do that, then the exercise is going to be even that much harder. Then during that time, we're working the exercise. And with exercise, we want, especially with somebody with chronic pain, we want to start slow. We want to start with gentle movement. A lot of times the tendency when it hurts really bad is to not want to move.
Sure.
And we want to encourage movement because we use the phrase motion is lotion. Movement also makes a big difference in opening things up and giving you the sense that it's okay to move. So between the education, between the manual therapies and the exercise, we work through that. And then as they progress and get better, then we start with strengthening and stabilization programs as well, which is stuff that most everybody gets when they go to physical therapy. But as a chronic pain patient, we're going to start much slower and progress slower and get that confidence back.
For sure, it is a process. What would you say to individuals that might be a little apprehensive to do physical therapy for an issue that they've been dealing with for years and years? Maybe they have had a bad experience in the past, or like you said, they're just scared. When your body's hurt, it doesn't want to move because it is afraid of that pain. What would you say to those individuals that might be a little apprehensive about this whole thing?
Absolutely. We get that a lot, and we get people that have been on narcotics for a long time, and they're tired of being on drugs, but they're afraid that if we make them exercise, they're going to hurt. Well, the tendency is, like I said, is to is to ease them into it and to educate. Once you are understanding what's going on, it relieves that fear and anxiety of coming in and starting the therapy. So it's a big part of it.
For sure. What are some things that you hear from individuals that go through, they start slow, go through your entire program? By the end, how much better do they feel a lot of the times?
It's amazing how we've had people come in, like you said, that have had pain for decades. And they're amazed that they thought there was no hope because somebody told them that they were going to be like this the rest of their life. And we show them tools and techniques and exercises and things that they can do to calm themselves down. And they end up having better function overall. And we even have people that have had multiple therapies and seen multiple doctors. And if they didn't get that 3-point message that we try to really get to them, the education, the manual therapies, and the exercise, and if we didn't get them in that good, congruent way, they may not have gotten the full effect of what we can provide. So we always recommend that, keep trying. And the most important thing is if you hurt, get a doctor's order and ask for therapy. It doesn't hurt to try most of the time. So
for sure. And I mean, the one thing that I always think about is when you're hurting, you just don't feel good, and that stretches throughout your entire life.
Absolutely.
And when you start feeling better and getting back to your normal self, everything improves a little bit.
Absolutely.
You see that? I'm sure you see that in patients.
Yeah. You see how the whole continents change. What's the word I'm looking for?
It all comes together.
It all comes together. The whole everything, the whole attitude about life, everything just is open and new and fresh. So
absolutely. Well, before we let you go, once again, where can people reach out to Cox Health for this therapy?
We are at Advanced Physical Therapy. It's a separate clinic from the Meyer Center. The Meyer Center is the main outpatient clinic. So they can call Advanced 269-8355. Also, to get started, we do need a doctor's order. So that's how that works. So.
All right. Very good. Well, Shauna Townsend, thank you so much for being here from Cox Health. We'll be back with more right after this.